Hello, my name is Lorraine Creech, Head of Nursing at Mesothelioma UK and Clinical Nurse Specialist at the University Hospitals Leicester for mesothelioma. Hello and welcome, and thank you for joining us today on this 6th live Facebook chat for Mesothelioma UK. These previous live Facebook chats have been led by Liz Darlison, our Head of Services, who is a hard act to follow. However, I will do my best and hopefully we'll try and pick up any questions that are coming through during the day, during the chat. Today we've delayed the start of our live Facebook chat to commemorate the minute's silence for all those healthcare workers who have lost their lives due to COVID-19. This has been advised by the Royal College of Nursing, by the Royal College of Midwives, by Unison and many other professional bodies. We're really commemorating those people who have paid the most personal price and the most personal sacrifice to mesothelioma and to COVID-19. Today we're linking those things together because it's also fitting that it is International Workers' Memorial Day, which commemorates all those who have lost their lives due to work-related disease. We know that many of you have lost your lives due to mesothelioma and other asbestos-related disease, and also now through COVID-19. We hope that the minute's silence, was a moment of respectful silence and shows our gratitude as a nation. Both mesothelioma, asbestos-related diseases and COVID-19 are public health disasters of our time. Thank you for everyone who's joining in. Thank you for Dawn who's joining in. Mavis is there. Good to hear from you, Mavis. It's lovely to know people are out there and taking part in the live chat. Advice about COVID-19 for mesothelioma patients is on our website. We regularly update that, so please take a look at it. You can go to www.mesothelioma.uk.com and look at the information we have there. We know that dealing with a diagnosis of mesothelioma during these very difficult times is extremely difficult, and we're very keen to capture your thoughts and the impact that the COVID-19 pandemic is having on you. So please, we know as the mesothelioma community that we need to come together. Please visit our website and complete the brief survey we have there. I mentioned Mavis a little while ago as we saw her joining in, but Mavis has been very helpful in helping us to devise this survey. It will give us a voice to take your concerns forward. So please, if you can take a look at that and fill it in online, we'd be grateful. If online is difficult, contact us via Mesothelioma UK and we can get a hard copy, but it's much simpler to do it online. And as I say, it's only a number of questions, so please bear with us. And we know that it was only open for a few days last week, and in those few days we managed to receive 65 responses, which was great. Great to see everybody. Belinda's there, Belinda's coming through, Emma's there. Messages are there all the time, which is good to know you're there. I'm going to repeat the advice about being extremely vulnerable or on the shielding list, because this is still causing some people some difficulties if you've not received the information or the advice letter. Please let your clinical team or your GP know. Every hospital has a person responsible for informing the government about people who should be on that list. And as we've said before, people with mesothelioma should definitely be on the list. We know it's taking some time, but please let your clinical team know. You can also self-register, and you can do that by contacting www.gov.coronavirus-extremely vulnerable. You can register there via this link for help with food shopping delivery, medication collections via local pharmacies and things like that. It takes little time, bear with it, we know, and we also know, all of us I'm sure, that food delivery slots are in very short supply. So don't forget to ask others. Don't forget to reach out to your family, your friends, your neighbours and other community groups. Only this morning we've had another link through, which we need this lateral thinking, don't we, about the voluntary groups that are there. There are Good Samaritan groups with our NHS volunteers and also the Royal Voluntary Service, which has been there for a long time. They are willing to help us. We're going to put a posting out on our social media later so that we can get that message out to you about voluntary services. But again, contact us if you need some help with it and we'll do our best. What's coming through here now? Let me see. All the links are going. Yeah, the links. Everybody at Sandstar is agreeing with me that the links are going to be there, so that's good. A senior member, or sometimes more than one senior member of our Mesothelioma UK team, join the NHS England weekly updates. These are becoming really important to us and a lifeline for us to get the message to you about what's actually happening and make sure all that information comes together across the UK, with including England and the devolved nations. We need to bring everything together. We have access to this through our partners at CI UK and Cancer 52. These meetings, as I said, are very, very informative and they allow us to say what we need from you and pass it on to NHS England. We know that the survey I mentioned a few minutes ago is going to be very important to this. So if you let us have your concerns and issues, we will try and pass those on. Again, in the past, we're reiterating some of the information, but we want to reassure you that NHS England are telling us about the cancer hubs that are being set up in every cancer alliance across the UK on many sites, and as the weeks pass they've become more proficient and more together, and the plan is to have one, as I say, in every cancer alliance. We know of last week that 8 of the 21 hubs have now got some surgical capacity. We know that surgical capacity was severely hit as we went into the COVID-19 pandemic because we were using facilities of surgery to care for our most vulnerable patients with COVID-19. So the surgical capacity is increasing. Some of these hubs are developed in local hospitals and some of them are actually in our private hospitals. Our private partners are coming together to help us, and we can use their services and we can use their facilities. So that's a good point, that we're seeing everybody digging in to produce the services, these cancer services. And sometimes, because of the difficulties with capacities in hospitals, how it has been, just taking that out a little, to adding the safety of the footfall through a private hospital. So we're grateful to them as well. We have all come together and we need to continue to do so. And as well as dealing with cancer treatments, they're also housing and hosting some of the other cancer services, like the departments that deal with appointments and also that deal with our cancer waiting times, because they are very, very important. We mustn't lose track of all those years of benefit that we've got because of the COVID-19 pandemic. Any questions coming through at the moment? Have a little look at you again there. No questions at the moment, I don't think. Just good to know that you're all there. One message which is hitting us loud and clear is that people are not always presenting to their hospitals with acute problems. And we know that people presenting with cancer diagnosis are not coming forward, and also mesothelioma. So it's very important, please, that if anybody has any suspicions, to go through the normal pathway, to see their GP, to get referred on to services, and then we can help. The other point that we know is very important is that people are not always reporting if they're noticing symptoms or change in their symptoms. People with mesothelioma live with symptoms, there's no doubt about that. But if you've seen a change in them or a new symptom developing, please be in touch with your clinical team, because there is often something we can do to help. The NHS is here for you. Mesothelioma UK is always here for you. Treatments have changed undoubtedly because of COVID-19, and that has been difficult for many people to take on, but now we need to think, if anything is changing, please report it. COVID-19 has been responsible for us losing our liberty. Some people have lost their livelihoods. Many of us, unfortunately, have lost families, friends, relatives and work colleagues. Please don't let it be responsible for people going on undiagnosed, or also a wave of people who may have advanced disease which we haven't addressed because people didn't think there was a way that they could report those or take those forward. I personally think that's really, really important, and I know that all of our mesothelioma nurses are experiencing a drop in numbers, and they are also fearful that people aren't reporting symptoms which we can help with. Early reporting is very, very important, as I keep saying. Multidisciplinary teams are still meeting, still communicating, and decisions about treatment are still being made on an individual basis, so don't hesitate to get in touch with us. As we know, yesterday the Health Minister Matt Hancock started to talk and mentioned about the restoration process, which will be very interesting for us to hear from NHS England about what they have to say about that tomorrow. That will be the recommencing of some cancer services which have been put on hold due to COVID-19. Hi Sean, great you're there. Hi Amy, Annie I should say, that's good. So as well as dealing with symptoms and everything that's going on, trying to keep our lives on track, we know that, that for some people, because of COVID-19 and having mesothelioma, they're becoming lonely and vulnerable. And if this is the case, please reach out. Please reach out to your family, your friends, and anybody who can help you. Mesothelioma UK is happy to hear from you if you feel you're in this situation. We know that some people are joining our Facebook pages, which is also very important. We have the peritoneal and we have the pleural Facebook pages. These can help you. These are people who know what you're going through and just becoming the experts in their own condition, so they can help you. So please link in with those. We also know that across the country, virtual support groups are striking up, and these can help. If you were attending a support group before, please contact the support group, and I'm sure they will try and tell you if they have any virtual support groups going again. If not, contact us at Mesothelioma UK, and we will do our best to find the link and refer you on. Isolation is a terrible thing, and we need to try and stop it if we can. So you can contact us via the free phone of 0800 169 2409. That's 0800 169 2409. Or you can email us at info@mesothelioma.uk.com. You can also visit our website, as I've said, but please also visit our website to look at our fundraising activities. It's vitally important that we try to maintain funds to help to support services, and we desperately need your help with this. Our Mesothelioma UK fundraising team are working so hard to try and maintain links and make sure that you're aware of the help that we need. So please, as I say again, visit the webpage. I think I'm making that point over and over again today, aren't I? Our social distancing challenge has 1 week to go. Everybody in Mesothelioma UK is taking part with this, from our trustees, our operational team, our nurses, and we really need to ramp up those kilometres. As of yesterday, we had achieved 4,200 of the 5,000 we need by the end of the week. My knees are certainly really feeling it, and I'm sure the whole team are feeling the same, but please, you know, we're trying to do that and we're trying to get that out. You can see the updates for that on social media as well. We'll endeavour to keep in touch with you. Please endeavour to keep in touch with us. As well as the live Facebook chats, we are going to show you some interviews, and we'll be putting those out on social media. We hope you find them interesting. The first one is going to be an interview with our peritoneal clinical nurse specialist, our peritoneal mesothelioma clinical nurse specialist, who is Sam Westbrook and based at Basingstoke. We'll put that out, as I say, live on our Facebook page after this live session. Thank you everybody joining in. Tracy is there. It's good to see Tracy joining in. So basically, our messages to you, I can't see any questions coming through just at the moment. I'm keeping an eye out on that. You're just telling me you're there, and that's really reassuring. Our messages are for you to try and keep as well as possible. Socialise if you can. Socialise the best way you can. This may be by the phone, online, via social media, but we know it does help. It lightens the burden for many people. Eat well if you can. If you are getting your home deliveries, do that. If you're out to the supermarket, I'm sure we're all eating better than we did before, because we're trying to maintain using those core things within our store cupboards, as well as fresh produce, which you can also get delivered a lot more, and more people are using a milkman than ever before, so it's very interesting times for us. Eat well, as I say. Exercise if you can around the home or in short distances from your home. Even if it's chair-based exercise, it can help dramatically. Keep those toes tapping. Music can help to lift our spirits, which is very important. And also, we know that we have Julie Roberts on our web page, our website, and also we've distributed those on social media, and she's telling us about exercise regimes which can be very helpful. There aren't any other questions that can see coming through at the moment. So basically, for today, stay well, keep well. Thank you for joining us, and we look forward to seeing you next week. Bye bye for now.